But I'm sure you've seen my letter. I am resigning as of the end of May, giving Kevin a full 6 months of my service before I retire. And this time I'm really retiring, so.
Yeah.
Mhm.
So we can't talk you out of it, is that what I'm hearing?
It's negotiable plus or minus. I think it depends on where. I think it's a good time. It's a good time for me. It's a good time. I just like climbed onto my Medicare bandwagon. It's a good time finishing up the opioid initiative. There's always room. There's so much that we do here in Mason County, and it's a very forward-thinking little town. And I think that there's a lot of things that can be done, and I think it would be a benefit to the community to get some new blood in, to try new things, new initiatives, and hopefully we have one candidate that's expressed some interest, is going to meet with Dave, and as soon as you decide what you want, because there are a lot of different options for how you want to go into the future. In the past, you've had a local practicing physician, who served as the health officer. And then you've also had professional health officers prior to Dr. Truxas. That was here before. Dr. Hoover was here, and then you've had me. So you could go back and forth, and I think it's a matter for the board to decide which way you want to go into the future, how many hours. There's also been talk about regionalization, regional health officers. But in order to do that, you pretty much have to have all the health jurisdictions in our region agreeing on it, and I don't think there is consensus yet. So I think it's up for more discussion for you. The requirements are that the physician be licensed in the state of Washington and have a master's in public health. Without the master's in public health, they can be appointed as a provisional health officer. But having the public health background, I think, is really, really important, because it's not just straight medicine. I mean, you can be a great doctor, good doctor taking care of patients, but in public health, the patient is your whole community, and you have to put on a different hat, change your way of thinking, because when you're treating one patient, what may be good for that one patient may not be good for the rest of the community. And so there are a lot of other issues. We've got an excellent staff here in environmental health and in personal health. You've got we're doing less nursing, traditional public health nursing, but a lot more of the work with the community that is so important. So I think it's a good time, and I will, once you decide which way you want to go, I'm very happy to help recruit and talk to people, vet folks out, see, give them a reality check. Because there are definitely differences in health jurisdictions. And Mason County is small, and we have a lot of the same headaches in terms of dealing, but most of that we can come to the administrator. But in terms of a lot of communicable disease control, we do have that, and it comes in little bits. Sometimes it hits us hard, and sometimes not at all. So it's like feast or famine kind of thing. but, you know, there's have always been a lot of concerns in the community. The one thing that I regret not being able to do anything about is our cancer rates. You know, because it's one of those issues that it's the accumulation of lifetime exposures to everything that raises our cancer rates. So in our highest numbers, it's really, when you drill down to it, it still comes down to smoking, and the use of tobacco is one of the highest risks that Mason County residents, and air quality as well, because the lung cancer rates are a lot higher than the rest of the state. But it's a tough one. It's a tough one to tackle, but we've tackled a lot of other little things, and we've done really good work on the environment, and continue to work on that. So I don't think you'll have a problem finding somebody to come and take over Little Mason with thumbs up.
Dave, will you be bringing back a job description for us to
So-
look at, or
so-
what's the process?
So the process is kind of however we wanted to go forward with it. I'll come back in January with a job description.
Okay.
But we'll need to talk about, do we want to hire locally? Do we want to contract with another health officer from another county? For example, Alan Melnick contracts with, I think, 3 counties now. He's also doing it now for Skamania. So
There's a new health officer for Skamania.
okay.
Yeah, we just
Um,
met her
Oh, okay.
last month.
And there's a new one up in Jefferson. So
Yes.
Jefferson has a new health officer. So there's some things I need to explore with the health officers association.
Yeah, the other option is to even approach, say, Dr. Turner up in Kitsap. You know, because we do a lot of stuff. The north end gravitates towards Kitsap, and whether or not, you know, she's a full-time health officer, if that's something that you want to do. There are pluses and minuses to a health officer covering a lot of different counties. It definitely can be done. I did it for 25 years, so it can be done. The only time it doesn't work very well is when there's a statewide emergency and you're needed everywhere, and you can't be in all the places at once. But yeah, there's a number of health officers that are full-time that might be willing to take on another county. And there are very part-time. There's also Dr. Edstam in Pacific County is retiring as well. So there's a potential for a health officer to do both. So lots of different options.
So through December and early January, I'll be pulling some options together.
Good,
Then we can explore that at the
Okay.
January meeting.
great, good, look forward to it, thanks.
I mean, we've already started having these discussions with the Health Officers Association. DOH has been having this discussion, and in part of this ask for the $296 million through Foundation of Public Health, one of the things they talked about was level of communicable disease response available. And we pushed back pretty hard last week because they were making it kind of an arbitrary assignment that if you have this much population, that your health department can only handle these kinds of diseases, completely discounting the capabilities of the health officer and the people who are already there. So to say that Mason can't handle tuberculosis is incorrect just because of our size. So there's some clarification. There's a lot of movement at the health officer level, plus the funding piece. So it's a very fluid thing happening right now. So
Thanks, Dave, we'll look forward to that.